Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. Hope you're doing well today. We'll be taking your texts and messages and calls in just a moment here. Want to thank our audience from Rumble, Live from America, TikTok, Instagram, Facebook, YouTube, all the different platforms that we're on. I think we're on 20 different platforms now, so very excited about this and love to chat with people and talk to them and get them ideas to how to keep themselves healthy, learn how to test to see what your body's doing, fine-tune your nutrients, and we talk about all of these things. So over the years, and 37 years of doing this in the radio, I think I was on 35 or so years, talking to people about what's important to them, and they want to know, how do I lower cholesterol, or why do I have knee pain or joint pain, or how do I improve this or that, why do I have a rash, why am I losing my hair? It's easy to understand your body once you ask it the right questions, and that's typically what the big blood test that I do will give us. And of course, there are other tests, MRIs, cardiac testing, looking for plaque in blood vessels, other things that fill in the entire picture, but you want that whole picture to see exactly what your body's doing and what you need to do to create better function and ability. I constantly get on the computer looking for interesting articles and gather info and talk to this about with patients that I see in practice. Put up articles in the exam room in different parts of the office so people can read these things. I point people towards Google Scholar, tell them to research things there in the search bar. A lot of great information. So knowledge is key. It's the best way to understand how to keep yourself healthy. There are a lot of people out there making I call them pseudo recommendations, because they know nothing about you. They've never looked at testing, never examined you. And they're saying, do this, do that, and this is what this will do and that will do. And in most cases, those things never pan out because there's no understanding of your body, of your blood work, of your hormone levels, of your genetics, of anything. So recommendations are made without any substance. At least when we talk about what I do with the blood work and make recommendation based upon that, and then retest to prove that the blood work shows benefit or that you're getting benefit based upon you're documenting improvements on your notes, we can prove that what we do is working. And that's the whole point. You just don't want to take something and be out in orbit and not know where you are and not get your result. So some interesting articles. This is one that talks about common sugar substitute called erythritol. It's been around in a variety of different supplements, and it's used in low-carb protein bars, different drinks, etc. It may directly affect your brain and your blood vessels. Now, this idea of the sugar substitutes causing problems has been around for a long time, ever since NutraSweet and the saccharin and, Sweet and Low, etc. has been around. But this is interesting. It talks about the erythritol affecting your blood vessels and your brain. So anything that affects your blood vessels, of course, is a bad thing. This study says it increases oxidative stress and reduces nitric oxide production. Nitric oxide, as many people have heard, helps to dilate and keep your blood vessels open, which is, of course, a good thing. You don't want any of these things affected in a negative fashion because you're decreasing effective delivery of oxygen, vitamins, minerals, and hormones to your blood. The Journal of Applied Physiology is where this research was published. And Auburn Berry, NMS, was one of the authors of the study. And I think we have to take these things to heart. We know that oxidative damage is where free radicals damage your tissue. So if there's a brick wall over here and I walk over and keep pulling the bricks out of the wall, I'm going to destroy that wall. Sooner or later it'll collapse. When we talk about cell membranes and such, the same thing occurs. Oxidative damage to that wall will make that membrane porous, and then bad things can pour into the cell and kill it, like heavy metals. So this is research and information that's been around for a very long time. But I try to make things, I give patients a visual, try to get them to understand things, and it kind of works that way. So if I'm sitting with a patient, I say, this room that we're in is like one cell of your body, and you have 100 trillion cells. If you and I are workers in this cell, we need to be fed oxygen, vitamins, minerals, and hormones to take protein sequences, put them together like a zipper so that they can go out and tell the rest of your cells what to do. That's a very important process. Messenger RNA, transfer RNA, all the different amino acids, ATGC, for people who think back to high school and college chemistry. It's a very important process. If damage occurs and free radicals get in and create destruction, your cells will break down and die. That's called apoptosis. So that occurs to more and more of your cells over time if you don't protect against that free radical damage. And the oxidative stress, we use antioxidant vitamins to help to correct that. So if we put together the whole picture, which I'm sort of famous for doing because I talk about this with every patient, you want to eat right, cut down the bad foods, get rid of junk foods, make sure we can correct and test and recommend vitamins for you. Now we're putting together custom vitamin packs for you based upon your blood test and your medical condition or your concerns. And you do some exercise, etc. You put the whole picture together, correct your hormones, your body will do extremely well. But you've got to get rid of these sugar substitutes. I think far better stevia, agave would be safer to use. And to a large extent, I don't want people to maintain a sweet tooth and always want something sweet. If they do, then they'll invariably grab something that's a bad food and bring too much sugar into their body. And then we can talk about glycation, which is another huge concept. Glycation is how sugars damage your blood vessels, your nerves, your cells, your proteins, your immune response, mitochondria. It's a very complicated process, but, important to hear about and understand it. Okay, phone lines are open. Our computers are wide open, brimming with people wanting to ask questions. 888
Yes.
420-9272 if you'd like to contact us.
Yeah, we got some questions. You actually answered one of them just at the last minute there. But first question was, are plant-based sweeteners like stevia and monk fruit better? Or do they come with their own
They're considerably
risks?
better because they're natural and made from plant. So, typically anything that has natural origin makes sense. Natural, plant protein powders are great. I use one every morning, and I put it, in my coffee. So I'm getting 21 grams of protein, nutrients. Makes all the sense in the world. Orgain is the one that I use, by the way. So if people like that product, it's organic and, again, plant-based. I used to buy it at Whole Foods, but I found a less expensive option for the same product in a larger size at BJ's. And I've had patients tell me they can get it at Costco. So why not save more than a couple of bucks? So, yeah, I think plant versions are a far better option.
Got another one here. I've used artificial sweeteners for years in my coffee and yogurt. Should I be worried about any long-term effects on my brain, hormones, or weight?
Well, they're talking about this, and it doesn't take a huge dose of these things to create that effect. In some comments in the article, it said even one exposure can cause some changes in the blood flow. So I think some of these things repeatedly can create long-lasting effect. Like anything else, too much of something that's bad over and over and over again will just make things, worse and worse. So I'd rather you switch over to the natural sources. That would make more sense.
Then I remember people used to say aspartame causes cancer. Has that been proven or debunked, or are they still real?
I haven't seen anything specific to that, but I still look. I mean, I get on the computer all the time. It's one of my favorite things to do. I think I've always been a trivia nut, and now it's kind of, the last 39 years, kind of turned into medical and nutritional trivia, and I like gathering information. So, yeah, I'll get on the computer and take a look at that. And Frankie might be able to do that, too, because he's got all these computers set up around him. But I also like getting people to research and get on the computer and look, do the same thing I do. You may not understand the entirety of the article, but I tell people to go on Google Scholar, in the search box, put in the term, and sometimes you have to put multiple terms in separately, meaning heart disease and lead, heart disease and mercury, heart disease and cadmium, heart disease and aluminum, or heart disease and heavy metals. But, keep changing the search term, you'll get more studies that can go back years and years. So I typically will tell people to do that, and some people bring in great articles, so the more educated we are, the better. And I like people being that little sleuth, the little investigator, the detective, because, they get into it. It just makes sense.
And we also have this question that was in the live chat before we even went live. And this guy didn't even know. They didn't even know what we were going to be talking about. But it happens to...
Maybe he's psychic.
Yeah, I think I got to investigate this. But the question was, is diet soda really that bad for you?
Yeah, I mean, the general term, and I try to tell patients, don't put anything into your body that's not doing something really good for you. It's kind of a good way to start the thought process. Diet soda doesn't have any benefit. And with those sweeteners in it, or the massive amounts of sugar in it, it's really bad for you. 40 grams, 46 grams. Every now and then I'll take a look on the shelf in a market somewhere and just look to see what's on the label. And the numbers are, I think, higher than ever before. So get rid of all the chemicals. There are a lot of people who like to have seltzer or Pellegrino or sparkling water and put a little lemon or a little flavoring in that. So you can do that. There are some people, and every good hotel I've been to in the lobby has a big glass jar with a little spigot of cucumber water or lemon water, and you could carbonate it a little bit if you like. There are even some companies that make these devices where you get some of that carbonated effect into the water and you put your own fruit juice in it. Why not? Just safer.
Right. And then we have a question just asking if you had to choose between a Diet Coke and a Coke Zero, they're just wondering, like, what is the actual healthier alternative? Like, which one would be the healthier?
Neither are healthy, so you can't say one is healthier. The regular full-on sugar is bad, and that we'll talk about glycation in a minute. I've got a good handout on that. The diet is going to have some artificial sweetener in it. So imagine either of those things sitting in your gut up against these beautiful stomach cells lining your stomach and sitting there causing some sort of irritation. The old saying is that, put some Diet Coke on paint on a car and it'll just erode the paint away. I mean...
So put it in your stomach.
Yeah, I'd rather have seltzer with lemon in it or squeeze some orange into it or lemon, orange, lime. I mean, you could do any number of things. And if you squeeze some lemon or put some orange slices in it, or you soak some of them in a container, or you put cucumber in it, just 1,000,000% better.
And then we got some people asking about, what about the Mexican Coke, cane sugar?
Well, cane sugar is pure sugar. Mexican Coke. I thought you were going to say, what about the Mexican ship, the sailboat? It's like, I don't want to answer anything on the Mexican sailboat. Yeah, so cane sugar is pure sugar. So is honey. Maple syrup. Monk fruit, and there are different companies that make these natural alternatives to syrup, like monk fruit, and it's far better than all that sugar in maple syrup. Think of how many grams of sugar people have per day without realizing it, from bread, rice, pasta, potatoes, oatmeal, grains, even fruits, but fruits are much lower, except if you're talking about oranges, apples, bananas. The berries have the lowest amount of sugar, but we have far too much sugar in our diet. So if we start to peel that back, then you burn triglycerides, cholesterol, body fat,
So I got another one. I've been hearing that artificial sweeteners like sucralose and aspartame can mess with your gut bacteria.
I think so, yeah. We've seen literature on that. I think I mentioned that a few weeks ago on the program. So, your gut is the doorway into your body. You don't want to mess with that. You want to keep putting good foods in, good probiotics, healthy things, healthy foods. Get your nutrients on board. I know a lot of people, I do it as well. I'll take a tablespoon of olive oil every day, either in the morning or night, because that can help to kill bacteria in your gut. There was some research I saw on that helping with Helicobacter, which is a bad bacteria for the stomach. So I'd rather put all the good things in and not let the bad things get in there.
And we just got someone sharing a story of, as a child, it is crazy to me because I had a similar experience where my parents were like, oh, they're having their coffee in the morning and they got their, stevia, or they got their, and they're like, oh, look how healthy we're being. Like, no sugar. It's wild to see it, in the back, in the rear view mirror.
So think of what's happened for a very, very, very long time. Companies make chemicals of various types in different companies. If you look at these chemicals, they're all really bad for us. And some chemicals are put into food, really bad. GMO is taking over, really bad. Pesticides and things that kill bugs, we have exposure to, really bad. I have patients that have MS and Parkinson's in the same patient, But the weird common denominator was that individual worked for his uncle in landscaping business and was spraying the malathion or parathion, to kill, bugs and termites and such. But exposure to that creates that damage, heavy metal exposure. So we can go on and on and on and talk about all the different things that are sprayed on crops. We can talk about some foods have 65, 75 chemicals in them to make them look good on the shelf. So when you buy them, you're getting something that looks good, but it certainly may not be good for you. Sulfates in wine. It's hard for me to think of things that chemical companies make that are actually good for you.
We live in a toxic soup, as someone once said. Can't remember who.
Not to even talk about injectable things, but, your body has this exquisite way of keeping itself doing the right thing. And that's how we're created. And if we talk about fine-tuning and fixing and enhancing your body, you want to put the best things in and keep the bad things out. We'll talk in a minute about dementia in the younger population, in middle age, which theoretically shouldn't happen at all. But I think it's from heavy metal exposure. I think it's from certain things damaging RNA metabolism in your cells and in your brain. RNA, messenger RNA, RNA. You can make the connection.
I don't want to make the connection, Doctor.
Okay, let's talk about that for a sec. This is a study from UC San Francisco talking about frontotemporal dementia, a condition that often affects people in midlife, and to some extent difficult to diagnose, but there are 50 and 60 or so year old people out there that have poor focus, concentration, they have difficulty remembering where they put their keys or person's names and things, and you wouldn't expect to see that in that population that age, but we're seeing it much more so. Now, I know it's from heavy metal exposure because I've seen patients that have huge heavy metal exposure and the correlations there. But this is a great study because it's bringing it, to the forefront. They're looking at frontotemporal dementia, often depression, schizophrenia, Parkinson's disease, which are happening in the younger population. They're talking about the specifics of mRNA effect and disruption in RNA regulation. As I say, inside your cells, there's a universe of activity going on, Golgi apparatus, mitochondria, RNA, messenger RNA, all of this. And once these things become distorted, then your brain becomes damaged. There was a great study done a few years back where in Italy they looked at people that had Parkinson's disease. And they were trying to understand what was going on. And those people that passed from Parkinson's, that donated their body to science, when they tested the brain and scanned every section of it, did a huge, pathological testing on it, they found the substantia nigra was filled with heavy metals. And that's why that area was destroyed in the ability to make dopamine. And that's why they think these people develop Parkinson's and other brain-related disorders. They also found there was no glutathione in their brain, which you should have tons of because that's a shield to stop free radicals from causing damage. But when you overwhelm it with so much heavy metal exposure, maybe that's what's destroying the ability for methionine to become the glutathione. For a while, doing glutathione IVs would help to stabilize some of the Parkinson's symptoms, but the progression of that damage from the exposure and just normal aging where you're losing cells, year to year as you get older, you're not making the new cells like you did when you were a kid, allows for progression of that. So that's why we have a comprehensive approach to neurologic disorders, Parkinson's, MS, all of these things, stroke, where we test for and correct vitamins, minerals, hormones. We look for heavy metals through blood and through 24-hour urine, looking at 21 metals, and putting together a program to change the picture, including stem cells, to put billions of cells in that create brand new cells, whether it's your joint, your heart, lung, liver, kidney, pancreas, brain, etc. So we really, all doctors should use a comprehensive approach, no matter what the patient presents with.
We got plenty of questions.
Awesome.
I'm trying to, navigate this YouTube friendly. You know what I'm saying?
Gotcha.
We got the whip lashed at us last week. So
yeah,
People are just asking to elaborate on the that connection, the mRNA kind of what they're exactly explaining in the article. Like,
So inside your cells, you have chemical messaging occurring. And you could probably pop up and look at some cool diagrams, and it may not be the easiest thing to understand, but you could look up RNA pathway, DNA pathway. You could look up protein transcription. Inside your cells, activities have to occur to allow metabolism inside the cell to work so that one cell and then all the cells of the organ function well so that the entire body can function well. It's probably the easiest, simplest way to say it. So let's say, for sake of discussion, we talk about using NAD for patients, nicotine adenine dinucleotide. And that's one cofactor that's responsible for taking oxygen and putting it through a pathway that ends up becoming 36 molecules of ATP, which is energy. If you disrupt the NAD or you damage that electrochemical pathway, you're not going to get the energy. If you keep damaging all of these areas, damage the ability to make proteins or protein synthesis, which in some cases proteins become antibodies, fats and proteins also can become hormones. You're disrupting the wonderful activity inside your cells. So you don't want any of these essential activities inside your cells to be affected. And that's 1/millionth of what's going on. That discussion is 1/millionth of what's going on inside your cells. It would be virtually impossible. Even if I had a floor-to-ceiling, wall-to-wall diagram of the Krebs cycle, citric acid cycle, all of these things, even for myself, as you walk through that, it takes a minute, and you've got to double think and triple think it to really understand it. So there's so much that goes on inside your cells. You want to be as protective as possible of your cells and your organs. So putting things in that can disrupt how proteins are transcribed, how proteins are made, how that signaling works, you don't want that to happen in any way, shape, or form. You don't want metals to come on board and cause Alzheimer's and dementia, because we know that aluminum is directly correlated with that. That's been in research for many, many years. You can go on Google Scholar, look up dementia and aluminum, or aluminum and dementia, aluminum and Parkinson's, aluminum and, stroke, all of these things. So the literature's there. Cadmium and breast cancer, literature's there. Just get on Google Scholar and look. So as I try to say with these articles, get the bad things out of your picture, put the good things on board.
This is a good question, and they were nice and YouTube friendly. I appreciate that. Are there any major studies underway tracking neurological health over time in people who receive these mRNA treatment?
Yes. I will refer to something that I took a little snippet picture of, a screenshot the other day. And let me just find that. It'll take me a second.
No rush. And thank you to the chat who's, I see you guys.
Love the chat, people. Love the chat.
Yeah, and you're adjusting your comments to make it more friendly for me to be legally allowed to say it out loud, so I appreciate that as well.
This is a study called Population-Based Study of Neurological Complications After Injection. And Maria Salsone is one of the doctors in on the research. This was done, I think, in Basel, University of Basel, Switzerland, 2023. So this describes exactly that. And it's not as though there aren't lots of these things. There are lots of these studies popping up. Let me see where else I have another comment on a study in the same vein. Okay, so deaths in 1 year are equivalent to deaths in all of other 33 years of those things. And Dr. William Mackis, MD, had put this out there. So you can absolutely positively go online and see this information and search it. It's there. Whether or not people will be happy that it's being discussed, I don't know. But the information's there. I could, if I wanted to, get 50 studies on the specifics of this and dig deep into how and why this occurs. But I don't know what would be palatable for me to talk about or to be able to put on the different platforms. As Frankie alluded to, I made a comment last week that someone somewhere didn't like, so we were notified of that. It wasn't recommending anything. It wasn't anything dangerous. I just made sort of a comment that most people would absolutely agree with, no one would disagree with, but someone had an issue with it. So in a way, I'd rather have people go and look and read and learn and see that and download, print that article out. Now, I tell people you don't have to be a scientist or a physician to understand the entire thing, but when you read the abstract, which is the discussion of what they were looking at and the method of testing and how many people are in the study, and it's cool stuff to read. I mean, every time I tell people to do it, they come back fascinated and they understand how to read the abstract, how it was done, results with specific calculations, and then, summary, and then conclusion. You could just go right to the conclusion. We looked at this because we thought it may be correlated with that, and this is what we found. And you can see the citation, where it was published, where the research was done. I've been doing this for 39 years, so I just love the idea that I can grab this information, hand it to people, show it to them, about any medical topic that you could imagine.
We have plenty of questions, Doctor. I don't know what I could ask because I don't want to get us snipped. It's crazy. You
could ask anything. It's just how I answer it.
Yeah. Okay. So let me see. All right. So what do we actually know about the long-term effects of, we went through that one.
Yeah. Long-term effects of that thing. People know about myocarditis. They know about arrhythmias. They know about, death in young people. A lot about all of this. So once again, you could look at literature that describes that. The number of athletes that have gotten ill over many, 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 many decades compared to a short period of time is nothing compared to the number that we see now.
And then we got this one. I had brain fog and memory issues after COVID, not after the vaccine. How do we tell the difference between neurological symptoms caused by the virus versus a treatment?
That's a good question, because lots of people that I've seen who were exposed, some people felt fine, some people felt mildly ill, some people felt horrible for 4 to 5 days or a week. It has to do in part with your own immune response. If you're immune strong, then you don't feel that bad when you're exposed to it. If your immune system's a little bit off, then you would feel typically worse. So there are common symptoms that we know correlate with exposure to viruses, and many different viruses exist, and flus, etc. So we can get a handle on that. It seems that the things that have happened with injections, and everyone's heard of the myocarditis and autoimmune issues, etc., those things tend to be worse, because I think there's some distortion going on, as a result. So without getting too specific about that, physicians treating people in both worlds can tell the difference. Either way, there's discussion of long haul, where people just aren't getting better over time from being exposed to a bug. And that's why we test. We correct your vitamins, minerals, hormones. We use vitamin IVs, vitamin C IVs to help improve immune response. And there's research of vitamin C IVs helping to inhibit viruses and make your immune system strong. So there are a lot of good things that can be done, but we have to have your body tell us what's going on.
And this is a good question. If someone has genetic risk factors for Alzheimer's or Parkinson's, should they be more cautious with any treatment that could affect inflammation of the brain?
A treatment that could cause inflammation would be bad. Food that could cause inflammation would be bad. Heavy metal exposure would be super bad, because that may be part of it, in the first place. So let's say there's some genetic component. That may not absolutely positively create the worst outcome. So some people may be carriers. Some people may have subtle or simple correlations with that genetic problem. But if you add the other bad things that we know make your brain and your body worse, then it's going to be worse. So it's the layering effect of having maybe some genetic predisposition and adding on heavy metal exposure or infections, or Lyme disease is a strange and crazy bug that we test for with neurologic and brain-related issues. And we did a whole wonderful podcast on that with Dr. Burskanos. So the genetic component for any problem may be there, but you want to make sure you're not contributing to it by doing other things. I think a person who has any genetic concern, who's a smoker, that's crazy. You're just putting 4,000 chemicals in your body. If you're drinking too much alcohol, if you got heavy metal exposure from a job, I mean, all these things add up in a bad way. So that's why we want to reverse that whole mechanism or that process.
And we got just a comment saying, how is this study not shown on every single news program around America?
Well, that's relatively easy to answer.
Wait for it to cut to break, and then you'll know the answer.
It's relatively easy to answer because what you see on TV is put there by specific groups on purpose.
That was good. You just avoided a strike on YouTube. That was impressive.
Trying to be diplomatic. Why, if we know, and I think everybody knows that there's a weed spray that causes cancer, right? Everyone's heard of that for at least a few years. Why is it still on the shelves in stores? Why has RFK Jr. had to come out and make it a point of stopping companies from putting crap in the foods here that the same companies make for other countries that are not allowed to put it in those foods? You know, why is that allowed here? You know?
We can go buy it right now.
Yep. So.
Poison. Yeah, that's insane.
Thank God for people who are educated, who read, who learn, and to want to get into the fray, like RFK Jr., to be able to change this, get the junk out of the foods, et cetera, et cetera. I'm very thankful for his perseverance and his desire to look and research and understand what's going on.
The chat agrees.
Awesome.
I'll leave it there. Pretty good on. I don't think I missed anyone's questions. Could an mRNA vaccine overstimulate the immune system in a way that affects the brain, like triggering inflammation that mimics like decline in the brain? Yeah.
So you could look up a great video of, I'm trying to think of the gentleman's name. He's a senator from, I think, Ron Johnson from Wisconsin. Yeah. And he had all the armed forces doctors there talking about different things and how the incidence of miscarriage and autoimmune and myocarditis and all these things have increased. Again, this is doctors talking about this with a senator. And one lovely woman was talking about the increased risk of abnormalities because of this inhibition of the p53 gene. So you could look this stuff up.
What is the p53 gene?
It helps your body fight cancer.
Got it.
So the more we learn, and again, with great people and researchers and McCullough and all these other people that are learning and trying to show what's happening, it's important. Very important.
Good chatter said, and it's all horse dewormer. I know that joke.
What's good for the horse?
That's my favorite thing. It's like, yeah, well, you know, it's called the dosage. You know, we all have different weights.
Yep. And some of these meds are Nobel Prize winning meds, by the way.
Of course. Okay, let me see. Make sure I'm not missing anyone. YouTube crowd, Rumble crowd. Got some LFA viewers.
Awesome.
We love to see it.
Awesome. We love our LFA group.
Check Reddit real quick. Is it true that ivermectin is becoming a proven cancer medicine?
I don't have all the specifics on that as yet, but there are studies about that. And, you can similarly look up online in Google Scholar and find that.
Yeah, guys, I just want to be clear. I did not know what Google Scholar was prior to Dr. Chris and I joining forces, but it is insane. I mean, Google is Google, but if you just add Google Scholar, you can click right into it. It's an entire database. It is incredible. Peer research, everything. It cuts through all the noise.
It's terrific studies. It's terrific information. And it's easy for people to look up, and when you have a question about something, you can start, digging and learning. So, it's important. And of course, I take a look at that and I try to, apply that information to discussions with patients. So it just makes sense. I have tons and tons of studies we talk about. So it's important to keep front line and learn about this as much as possible. There's a great deal of discussion of that, but I can't comment on it until I either review and show journal articles about that. Now, on one hand, there may be people that don't like that discussion. So I'm not sure what kind of discussion I could make. Even though those studies may be from a traditional, research facility, which really should be completely fair to be able to talk about. I'm not sure who would or wouldn't like, the discussion of things that are not completely understood or endorsed by certain groups. So,
got it. This is a bit of a change in topic, but we have a question on YouTube just asking about hormone therapy for their kid who's a bit shorter than he'd like to be. They're thinking about that.
Sure. So for short stature, for many, many years, the recommendation has been to use growth hormone. So if a growth hormone level, IGF-1, is low, and the child is anywhere between 10, 12, 15, or maybe even up to 18 or so, then the endocrinologist, the pediatric endocrinologists, are the ones that can make the recommendation and follow and treat that child to create a little bit more height. The rule of thumb, no pun intended, is that when your bones close and you can't get taller, that's not going to create height, but it has to be done before the bones close. So that's why traditionally a physician might, if the child is in their later teens, do an x-ray to look at the bones and see if they've closed or not. So that growth hormone injectable protocol is typically done by the pediatric endocrinologists. And it does work. I mean, it's been around for a very long time.
Just seeing if they're just wondering if there are any issues with it in long-term studies.
I'm sure there are a lot of studies on it. I've never heard issues or side effect or risk with it. But again, I'm not a pediatric endocrinologist. I know that it exists. I know it's been around for a very long time. And similarly, you could sort of Google Scholar that. Take a look. If your child has that, then the first doctor I would see is a pediatric endocrinologist. Because that's what they do all the time.
All right.
As you get older, we can recommend improving your IGF-1 levels because that's great for hair, skin, nails, sleep, memory, focus, energy, mood, sexual drive and function, muscle response to exercise. So as we age and we're losing some of these hormones, whether it's thyroid, DHEA, testosterone, IGF-1, if you evaluate these things and you walk it back and bring them back to where you were a few years prior, you get your results back.
We just have a question on swelling of the head. When she wakes up in the morning, she feels like her brain is enlarged. She's always thought that it was allergies, but it seems like this could be a good...
It's not as though the brain would be swollen. That would be, an emergent situation, from something that's super bad. But people can feel brain fog or headachy or just kind of clogged up. It can be from allergy. It can be from infection. It could be from hormone decline, heavy metal. It could be from any number of things. So that's what you want to evaluate. And again, you don't want to just look at, well, let's say it's allergy, take an antihistamine, see what happens. You want to find out exactly what it is. So if it's something that you're eating that you have antibody production against, then you want to take that thing out of your diet. If it's nutrient or mineral deficiency, you want to correct that. If it's a virus, then you want to address that. So it depends upon what we find is the underlying cause. People traditionally, when they have a weird symptom, will try to do something, and they'll think it's this or that, and without testing, you're not going to hit the nail on the head, and they'll try something to try to improve it. And then when that thing doesn't work, then they're more confused. But with issues that you have, you should present them as if you were doing a report, for your teacher in college, or a report, when the attending doctor comes in and the interns and residents have to describe what Mr. So-and-so has and why he's there in the hospital. So you have to outline the severity of the symptom. Does it come and go? How often is it there? How long does it last? So the more you put that together, when you present that to a doctor like myself, then we have a better picture as to what may be creating the problem. And then we test accordingly.
She just comments, she said, it feels like her forehead is stretching, like it's stretching out, and her face just feels swollen, and yeah.
Well, brain swelling is obviously very severe and very different, but you have sinuses inside your head and your on either side of your nose and your eyes, so sometimes sinus pressure will cause that. So that's common that could be allergy related, but that's easy to test for.
Especially if you're on Long Island. It's like,
yeah,
I've washed my car 5 times this week.
Yeah, the pollen's out there in record numbers. I just went and I bought, just to talk about that, I have a gentleman, a friend of mine, who owns a great place in Oyster Bay, and it's Collector Car Showcase. And they've got beautiful cars, and they buy and sell cars and the whole thing. And they also wash and clean your cars, wash and wax. So when I need, I can call them. They'll come, take my car, bring it there, clean it up. Perfect. I don't have to do it myself. But sometimes they're busy because they're very busy. So I went to Home Depot, and I'm looking at different things. I'm like, because years ago I had a little power washing device. So I bought a power washing device, which if you get these quick connectors.
You got the green one?
The what?
Did you get the green one?
Yeah. So you could pop it on the power washing machine so that your hose with its end, so there's a male end, a female end, pops on, pop off. It's quick connect. It's easy. And just power wash my own car. Soap it up, wash it like back in the old days. When I was in college, I made a good amount of money because right before I got to college, I was working at a body shop, helping to paint cars, sand cars, and do the whole thing and polish them. And it was fun. And we restored some gorgeous cars back in the day. But, for people who needed their car to be washed and waxed, or even I would use very, very fine white compound to polish and to get some of the bad top coat of gunk and paint off the car and then polish it up was a great thing. But it's nice now and then to do your own thing.
Yeah, we got someone in the chat talking about a foam gun they got on Amazon.
Yeah.
I've always wanted a foam gun.
Yeah, no, those are great. So I got one of those because another place that I would go to, and when I see them doing the work at the Collector Car Showcase, they have a gun. It just shoots a massive amount of foam all over the car. They let it sit for a little bit, and they wash everything off, scrub and wash everything off. It looks great. It's fun. It's nice to do some of that stuff every now and then.
We got to get back to the basics, We're getting too complicated.
The basics.
We got to go places.
I remember even further back when Simonize was the wax to use on the car, and you couldn't wax the car if it was in the sun because the wax would dry up, and it would be impossible to take that off. So you'd have to wash the car, make sure it was cool, put it in the shade, and take this paste wax. You could rub on half of the hood, and then you had to take it off. And it was hard. Your arms would get big just from doing that. But that was the best way to do it because you had this nice, long-lasting wax protecting your car. And you can just wash it for the next couple of months and never have to do anything beyond that. Now it's a whole new science where you spray it on, you wipe it on, and, it's just as good. But
it's affected the karate community.
Exactly.
All right. What else we got? People are just saying they love washing their own cars.
And speaking of the karate community, we do have a little bit of a connection, a family connection, if you think about going back to your wife's family. So we won't say anything more about that, but that's a good connection.
Exactly. All Are there early cognitive tests people under 50 should be taking if they're noticing any memory or focus issues?
Yes. So I think the first thing is just blood work, vitamins, minerals, hormones, blood and urine for heavy metals. That's a great start. We have a device that you wear a funny looking cap on your head, and the cap has 20 different connectors, wires that go to a computer. And when we put that onto your head, the little openings before we pop the connector in, which is just a little piece of steel that sits up against your scalp with a little bit of paste on it, reads your brainwaves. So it takes about 45 minutes, and you're on the computer and you're answering questions and you're doing things and looking at speed of response. So it's a great way to get like a 12, 15-page report on your brain function. It looks at every component. Very significant test. So that enables us to understand what may be occurring or changing within the brain. So that's probably the best test you can do. MRIs and CAT scans look for tumors or damage, or SPECT scans look for loss of blood flow. Functional MRIs can look at loss of function in different regions. Sometimes the CAT scan or MRI will show vascular ischemia. So different tests will give us different types of information.
Chat wants to know your thoughts on Neuralink.
I'm not 100% sure on that yet. I mean, I understand how technology is moving forward. I think there are patients that might benefit from that, but I just have to see more information on it before I could endorse the idea.
Yeah, you explaining it, it's almost like I'd imagine, you explaining those 20 different. I'm assuming it's more of an internal version of that.
It would be an internal version that would help to theoretically help improve the neurologic connection to improve medical conditions. Again, I haven't done, and I don't think there's enough research on it, but I think for some people it may be beneficial. Now, if we walk it back a couple of months ago, where we had a wonderful interview with a gentleman, Tom from Canada, where they did try to do the deep brain stimulation and a variety of things getting into his brain, which didn't work, that makes me wary of anything that you might try to put into your brain. Would really have to be proven to me with research and with evidence and documentation that it's really safe and there's no downside to it. And maybe there will be. I don't know yet.
It'd have to be a lot of money to be on that trial run, I'll tell you that much.
Yeah, so knowing the man who's behind some of the coolest stuff, I'm sure he'll just take a whole bunch of people that might need that desperately and just do it for him and then get a study published,
Right. Crazy times.
I'm totally for medical advances, absolutely. But it's hard to comment on something when you don't have a big population of people of different ages, backgrounds, ethnic groups, every type, do something and then be able to comment on that. So I think we're not there yet.
The chat saying we wouldn't even have to go to Rumble. We could just listen to you. We just
Wait a second. All right, it's coming in now. Yeah, it's fascinating to me when you see some of these posts about, well, before 1940, this is what existed, and then before 1950, or they'll say, what was the world like back then? You're like, wow, no phones, no cell phones, no this, no that. Wow. It wasn't that long ago where we didn't have a lot of the things that we have now. And, cell phones and computers, for example, they didn't really have anything. Well, they may have had in certain applications, but when did cell phones start to come out? In the late 80s? I think right out of medical school, these things were starting to be made. And
the bricks.
Yeah, I was in practice, and one of the first cell phones I got was in a little bag that you connect to your car and plug it in, and you had this phone with a wire that was in your car. You could carry it around. You look like I don't want to say an idiot, but you look like, you're pretentious carrying a bag over your shoulder and talking on the phone. And now it's a different world, by light years. And computers, I remember the first computer I had, I would have to sign up, get on with that annoying sound. So you'd connect to the internet, and I would get on a link that had studies on vitamins and nutrition. So it was great. Health Database Plus back 30 some odd years ago. And now, like you say, you can get on your phone, get on your computer, and in literally milliseconds, boop, there's your answer. Forget about ChatGPT and all these other AI things. That's, well beyond. So what's going to happen in the next 10, 15, 20 years with that realm, It's amazing to think.
Crazy. And my favorite example of looking back is if you've ever seen the news reports of when they decided to make drunk driving illegal.
Yeah.
And you're talking to them like, soon enough it's going to be a communist country taking all our rights. It's like...
Yeah, some people don't want to give up those things or anything. But yeah, it's fun to look at some of these things from back in the day. Many years ago, I worked in a doctor's office, and as, not a spoof, but as an interesting picture, there were doctors who were endorsing smoking because it makes you feel good, your throat is soothed, et cetera, et cetera. And this is before anybody realized that it was causing all the cancers. But there were advertisements that the tobacco companies put out to try to get people to see, oh, yeah, he's recommending it, this movie star is recommending it. And that may be back in the 40s or 50s, I think, when those things were out. And you can find them. You can find those posters online. It's scary.
Crazy. We got the crowd, some of the crowd remembers.
Yeah. Not that long ago. I constantly talk about my friends with things that we did when we were younger and how different the world was, And a lot of my friends that have kids are like, wow, it's just, I feel bad because they just don't have the connections that we had as kids, And we didn't have much. Didn't have phones, didn't have computers. There wasn't a TV in every room. There wasn't any of that. And we were great. We were happy, maybe happier. We were better adjusted. We had tons of friends of all backgrounds. And I've said this before, the group of friends I had that lived right around the block where I lived, there was 30 of us, guys and girls. And we had, for the guys, a baseball team, a football team, a street hockey team. We played every sport you could possibly play. And 3 or 4 blocks on one side, the other side, north, south, east, and west, were another group of kids. And, we had teams where we would go and, play against them. So it was great. I mean, there were so many teams and so many people. It was terrific. When I played Little League, it was the greatest thing ever because you get that call and you got to show up at the town hall because they're picking the teams for Little League. And then a week later, you'd pick up your uniform. And it was just terrific camaraderie. But there's so much of that just isn't around anymore.
And the losers didn't get trophies back then either.
Yeah. You had to play hard to win.
Yeah. Yeah. Well, in a different life, if you were a doctor, in another century, you'd be prescribing Marlboros.
Yeah. It's interesting. And if you look way back, and I went to an amazing antique fair in Brimfield, Massachusetts, which I'm still sure is going on 3 or 4 times a year. It's massive. You drive up to Massachusetts, and it's right past Sturbridge, I think, which Sturbridge is an old restoration village. And for a few miles along this one road, you have a few hundred yards deep on either side, every vendor for every antique thing you could ever imagine. Everything from silver and old watches and furniture and stuffed animals and everything that's antique you could ever imagine, they had there. And at one point I was looking at this surgeon's Civil War surgical kit, with the bone saw and all that stuff. I ended up buying that. I was going to kind of put it up in a display case in the office, and I figured it'd be a little bit too graphic. But, you saw an embalming kit. I mean, you saw things from back in the Civil War. And then now you can't even touch them because the apothecary jars from pharmacies that had different labels of tincture of this, tincture of that, and of course most of them are empty. It was pretty interesting to see that how a doctor would write a prescription and write a drop or this amount of this and that amount of that powder and would make his recipe on the prescription pad for the pharmacy to give to the patient. So
that's very
pretty cool stuff. I got to go up there again. I want to wait till the end of the summer. Then in September they have a big one. But you got to book now to get the room if you want to stay overnight because it's amazing. You could go for hours and see old photographs, newspapers, stuff on back in the old Hollywood celebrities and picture. I mean, everything you could imagine would be antique they have.
And I see you, Marianne, in the chat. She loves antiquing.
Oh
She's
yeah,
enjoying this.
that is by far the mecca for antique. And I've been down south in New Orleans, which I love as well, has some wonderful stores with old Civil War memorabilia, and I've done that. I remember buying an old Civil War sword. I think it was at Brimfield.
I may have picked that
A
one up.
cavalry sword. Yeah, cavalry sword, gorgeous, And then I have a few other things. I bought an old Civil War gun, a long rifle, from a place in New Orleans, right on across the street from the Monteleone Hotel. I forget the name of the place, but I'll mention it. I'll mention it next time.
All good.
We all good?
All good.
Yeah. So I don't know. I love antique stuff. I love learning about antique civilizations. I have an old scalpel from ancient Rome, which it was a gift I was given to by somebody who's from Rome, etc. So yeah, I love all the antique things, antique history stories. I have a friend that I want to go be able to visit and get to the Vatican and get the inside tours. And so yeah, I just love old history.
Yeah, I was on my way to Huntington a couple weeks ago, and there was this just a pop up in the historical area. There's a pop up.
Yeah.
Just like me and Sabrina were just like, let's check it out. And immediately I see one of those, the Freemason.
Oh,
you
yeah.
know, I see a coin or a pin. I'm like,
Yeah.
mine, mine.
Yeah, so I've always gravitated towards, antique things. I've gone to Teddy Roosevelt's house, Sagamore Hill, a few times. Probably first when I was 10, and my grandparents, my mom and dad went there. And then when my nephew was 10, we brought him there. And I've gone back many times. It's just a wonderful story and great to think of what life was like back then.
Yeah.
In my office, I have amazing pictures of Pompeii and also Rome and all the countries I've been to, because it reminds me of when I've gone on vacation and was able to see all these things. And looking at civilization back at the time of Pompeii and the Roman Empire and stuff, it's incredible. It's fascinating.
Pompeii. I mean, it's one thing if you're seeing something from the Civil War and then you're like, oh, this is how many hundreds of years
thousands,
before
yeah.
Jesus Christ?
Yeah.
What?
Yeah. Thousands and thousands. And the other thing that's cool, too, is that every time I turn around, and I'll look online for these things, archaeological digs, they found the house where Herod lived. They found this house. They found a pool in Siloam, I think is the name of the area, where the baptisms occurred, whether it was John the Baptist, etc., and the Jordan. I mean, so they have recognizable areas that are historic facts from the Bible going back so many, obviously thousands of years. So it's amazing to me that some of these things keep popping up. This is this place. Wow, they're proving the existence of these things.
It
So
all lines up. It's insane.
pretty amazing.
We got some Pompeiians in the chat.
There you go.
Suzanne went there twice, and the second time, about half of the things that she saw was not uncovered. The first
They're
time.
still digging, I think.
Oh yeah, COVID. I think they found an acre.
Yeah. They're still digging. And then they're finding out exactly what it was like then, what they were eating, how they lived, the animals that they had with them. And it's unbelievable information.
I'm liking this little tangent we just went on. Yeah. Also, just on the last note, as a child living on Long Island, we have these incredible. We're so lucky that we have like the Vanderbilts. You know, you go to their and you see all the things they collected.
Sure.
But as a kid, you cannot appreciate these things.
No.
You're there as on a field trip. You're in like fifth grade.
You got 2 minutes of attention span. You're like, okay.
Right. And then you go back as an adult. You're like, you're blown away.
Yeah.
Yeah.
When I was 15 or 16, my uncle, Charlie, rest his soul, was an English teacher in humanities at Jericho High School. And he went to sabbatical for a year in Italy. It was in Florence. I was a kid. What did I think? I want to hang out with my friends. I want to, meet girls and things. I didn't think, let me go visit him for the summer. I should have, knowing now, I should have gone there for at least a month and just experienced Italy. It would have been a dream, but, at some
Hindsight's
point,
20/20.
I'll figure out how to get to Italy for a month.
You're making all the right decisions there.
Yeah.
You'll get there.
Yeah. Doing my best. I have a great friend, and his wife and his 5 children are there now, and they've been in Capri and that surrounding area, the Amalfi Coast. I think they're doing a 2-week trip, and I look at the Instagram post. I'm like, Look at that food. Look at that water.
In front of the cave, I saw the picture.
It's like, oh my God. It's astounding. And they know exactly where to go. They've gone every year and they travel a lot, but they do it just the perfect way. But to look at some of the food and how perfect the water is, it's just this big tease, and you want to live vicariously through that, of course, but having a wonderful time. Now when they get back, I want to be able to see, hear the stories and see more of the pictures. But yeah, it's a wonderful thing.
It's one of those things you have to go there and just think, how can I make this work? Can I make it work and live here forever? No,
Yeah, right?
probably not.
Everybody asks the same question. How do I do this? And how can I think what people have to do, because we get caught up with work and everything here, and it kind of drives us crazy, and you think, well, I should start thinking about a vacation. You got to pick 2 or 3 months out. This is where I go. This is what I want to do. For some people, you put aside the money or keep putting money into an account that would cover all of that. And then you work towards that, and by the time that comes around, you're good. Because people who try to plan it, let me try to get away and do this. And, everything that's going on gets in the way. You got to plan it in advance.
Rachel in the chat says, I feel like I'm in this conversation with you guys. One day I will figure it out.
Yeah,
Tuscany forever.
Because I have pictures of everywhere I've been, Italy, various places, Rome, Florence, Venice, Ischia, Spain, Monaco, Saint-Tropez, England, different places I've been, and I put the pictures of my exam room so I can just kind of look and think about it. And patients love it. I have, interesting artwork in the walls of the office. And it's just nice to think of other things and how other civilizations exist and what's happened over time. And then people, I was there and I saw this, and, it's a nice conversation. You don't want the entire visit to be all about just medical stuff and not talk about patients' interests. So that's why the conversation becomes, more enjoyable. Okay, so let's take a look at another couple of comments on food restriction. Another study came out, and it was through the European Congress on Obesity. It just came out this year, talking about restricted eating. The 8-hour time-restricted eating period may be the key to long-term weight loss. So everyone's heard about intermittent fasting. The idea of fasting has been around for centuries, but studies now talk about the benefit of avoiding foods for the early 8 hours of the morning. So if you wake up at 7 o'clock or 8 o'clock and you're fasting for 8 hours, and then you pick a certain amount of time to eat within the course of a few hours, it seems to be a better mechanism to help to lose weight. And this has been documented in different populations, a lot of people throughout the study. Some people did a 12-hour restriction. Some people did a later restriction, early restriction, but the weight was lost better within the 8-hour time restriction. So interesting to see. And we see this a lot with patients. The other good thing, too, is that it's been seen and shown, and I've seen it with patients for years, if you wake up in the morning and you do exercise right away, you'll get a better result with weight loss and metabolism than you will if you eat first and then you exercise, or if you exercise later in the day. So for a lot of people, doing a little bit of cardio as soon as they wake up is great. Of course, a person who may have thyroid issues, take your thyroid pill as soon as you wake up with a sip of water, do your exercise. Now your thyroid's helping you with the exercise. Or you take your vitamins with some water. Some people want to take a cup of coffee or an espresso. Yeah, but then do your activity first thing in the morning. And people tend to get a better result. They feel great, energized for the day. So that seems to make sense as well. I tell patients, whatever works for you, but try some of these things because it works for so many others.
It's good to break the habit, too, if you're just doing the same thing every, you know what I mean?
Yeah, you got to keep changing it. So people that just walk every day at a slow pace, nowhere near as good as walking slow, brisk, fast, changing it up, going different routes, indoor bike, outdoor bike, Pilates, yoga, weights. Just do every different thing that you can, because that, in a way, cross-training will create much better results for your body. If you just walk, or if you're just doing the same exercises for weight training, your body gets used to it. If you change the machine or do a different approach and you keep changing it around, your body gets much better results. We have some questions through the website.
Just real quick.
Good.
We got a question ask, is it better to just walk than to actually get on a treadmill? Is there a problem with treadmills? They've heard some things.
I don't know that there are problems with treadmills. Some people like them because you could change the speed. You can elevate the treadmill, which gives you a little bit more of a workout.
Oh, specifically knee related.
Well, I think regular walking typically is fine, and the regular treadmill may be fine. Elliptical is good too, or some of the gliders are good if you have knee issues because you're taking some of that load off. I mean, running obviously might be bad for someone's knees, but between the treadmill and the walking, probably negligible. I mean, treadmill you can do if the weather's bad. And walking you can do if the weather's a little bit off, but just, bundle up. I have friends that used to come over and stay at my house, and even in snowstorms, they'd love to go out and walk. I'm like, okay. I used to do it with them. It was fun. Got to bundle up, but it's nice and cold, and, you get all warmed up. But, it depends upon what you like and what your body feels, good with. I think after a while, the more of the cardio that you do, even at a comfortable pace and changing that pace, your body just acclimates and does better and better. And I've gone hiking upstate, etc., and, going up and down. And even if it's brisk or cold out, it's just great to just huff and puff and, get your blood vessels dilated nice and open, get a delivery of your oxygen, vitamins, minerals, and hormones. So I tell people to do as many different exercises as they can.
And I'll just say, if you're walking or jogging in the snow and you slip, it is your fault.
Exactly.
And that would be me.
Yeah. Got to be very careful. Black ice, you can't really see it, and all of a sudden your footing's bad, you slip. Whew, it's bad.
Not forgiving.
Okay, let's see. Some joint aches and pains. Patient doesn't know why they're there. I mean, differential diagnosis could be a variety of things. Could be virus, could be Lyme disease, could be bacterial infection, could be wear and tear on your ligaments, tendons, cartilage, joints, etc. So those are the things we obviously test for. MRIs are great tests because it shows you the entire joint as opposed to just an X-ray that shows you the outline of the bone. So it's not hard to pick up why you may have these things, but your body has to tell us. That's why the blood test is there for that. Also forgot to mention Garden City office, if you'd like to call it any time, 516-794-0404, and the website drcalapai.com, drcalapai.com. Indigestion, Patricia, and bloating, not sure why it's occurring. For a lot of people, we see that correlated with a delayed reaction to a food allergy. So if you eat something today, it doesn't mean you have to have a reaction the moment you eat it. So for a lot of people, when we test for allergy via blood or skin, we'll find things that are creating problems, take them out, and then the bloating goes away. Happens all the time. I mean, every week I talk about this. And for most patients I talk about, and we talk about what they're eating, what they're trying to avoid. I mean, a lot of people have bloating from grains, rice and some of the carbs and bread and pasta. So when patients listen to their body and then write it down and then we talk about it, it's easy to find, what their body may be reacting to. But we would run the gamut, test all of those things. And of course, the specifics of the vitamin testing. Once again, and the comment I make lately about your body is that it's a massive electrochemical machine. And it needs vitamins, minerals, hormones, oxygen, all of these things. And when that machine is not getting what it needs, you see poor or less function. Aging is the loss of cells and therefore changes in organ function, neurotransmitter production, hormones, etc. So when we learn about your body and we fine-tune and create perfect vitamin levels with the vitamin pack that we're doing, because I've made that into a custom pack. I use a recipe sheet, and I'll put different nutrients in. I'll check them off for the AM pack and the PM pack. So you don't have to go crazy. Everything you need based upon your blood work and your medical concerns or conditions right there. And after a month, we recheck to make sure those recommendations are perfect. We can add, subtract, do whatever we need based upon your condition to make your nutrient levels perfect. But the more activity you do, the more nutrients you need. You're going to burn them up faster. Older population doesn't absorb as well, so it might need higher levels of nutrients if you're only absorbing 30%. So we put this all into the appropriate picture. You'd be surprised how many people report some evidence or type of indigestion, bloating, stomach issues. It's rampant because people are eating foods that are just not great foods. Not even going to talk about how bad junk food is and fast food is. those will obviously cause more problems than good and healthy foods. And even with good and healthy foods, you could be allergic to them. So just got to keep them out of the picture. John's diabetes type 2, not getting the results he wants. His sugar's still too high. He's taking metformin. Well, medications are trying to change the number, but not change the cause of the problem. So every diabetic I've ever seen, we talk about diet. What are you eating for breakfast, lunch, dinner, snacks? Most people still, even though they're diabetic, and it may be the fault of their doctors not telling them what to do diet or nutrition-wise, they're still eating way too much carb because they're ingrained psychologically to have cereal or grains or bread or toast and sandwiches and etc. and pizza because that's what they've always had. But if you cut the carbs down, then the intake of sugar decreases coming on board, which decreases your sugar. If we check your insulin levels or look at your C-peptide and fructosamine, markers of your sugar, and C-peptide tells us about insulin production, and that's off, then there's more of a pancreatic decline. So we talk about not only doing the low carb, but the exercise to help to burn the sugar and fats as primary fuel, hormone correction, vitamin and mineral correction, and then the ultimate mechanism to repair the pancreas is stem cell. So we take your own stem cells, takes a minute and a half to extract, do an IV, the stem will know where to go based upon the damage and degeneration and the biochemical and mechanical signals, and then you're getting more of those cells become pancreatic cells that make insulin, so that's how you change the entire picture, not just one approach with one type of med that works one way or a different type of med. It should be right off the bat, you're starting with those low carb, the exercise correcting vitamins, minerals, and hormones. And if that works, great, if it's early on. But if your pancreas is weak, obviously stem cells are the way to go.
Just got a quick question. Someone just saying that they've just found out they're allergic to strawberries. 55 years old. What causes this? I love strawberries, and I don't want to stop eating them.
It's hard to say. There are so many people that are allergic when they're a kid, and that goes away later on in life, and vice versa. There are women who have no allergy as a young woman and get pregnant, all of a sudden they have allergies, and vice versa. So there's no real rhyme or reason. Sometimes exposure to something over and over and over again may start to provoke your body. So the other thing, too, to talk about is there's a reaction to that food itself, which we can find on a blood test or certainly on a skin test. There are reactions to the chemicals in the food, the GMO nature of that food, and not the food itself. There are people allergic to gluten in wheat, but not the wheat on the skin test. So we have to look at the potential for a few different ways of that substance causing you a problem. Either way, when we find out, we take it out of your diet, your body does dramatically better. And you don't want to spend tons and tons and millions of cells binding to foods and propagating and continuing the allergy picture. You want to reverse that because that'll cause inflammation, symptoms, etc. So in a perfect world, you get rid of the foods you have bad reactions to.
They responded, that sounds stupid. It sounds like you're a little angry, all right?
Stupid or not, this is the way that it presents. I've seen this for so many years and had the same discussions with people over time. Certain things we'll never be able to fully explain, and that holds true in every realm of life. But the allergy picture, once it's there and it's documented, you just got to avoid it if it's a food. If it's tree, grasses, weeds, molds, environmental inhalants, then you can do treatment, whether it's a weekly shot or we even do drops under the tongue to help desensitize you, which you do at home. Yeah, sometimes people don't really like the answer, especially if I tell them not to eat something.
Clearly. I wouldn't be happy to either. Okay, so strawberry shortcake's my favorite cake.
I love strawberries.
I'll be honest.
I love all the berries. I love fruits. And I'm not big on having the high sugar fruits. I'll have a banana now and then. I'll have a sumo citrus, the deep pecan citrus, which are gigantic oranges, and they're very delicious, very sweet. The skin is easy to peel off, and they're just the best oranges you could have, but they're the size of a grapefruit or a softball. So those are good, but I'll have them now and then. In moderation, some of those things are fine. And, I'll have some of those things right before I exercise. So I'm going to burn through it anyway, so it doesn't, affect me negatively.
What else we got? He said he's just kidding. All right, we know you're kidding. We know.
I'd rather joke around and have him say, nah, it's ridiculous. It's stupid. It's more fun. Look, the show is all about fun. I don't want to make it a constantly medical downer show. No, I don't want to be Dr. Downer. I want people to have fun with it. And just as I do in practice, walk away with some cool ideas and look at research and have fun.
Someone's asking if we're doing a show tomorrow.
Tomorrow is Saturday. So, yes, tomorrow will be
I think they're just asking because it's a holiday week.
Really big show.
Really big. Monday, no.
Correct.
Obviously.
It's
and
interesting.
You guys shouldn't be wanting it either. Enjoy yourself, barbecue.
Exactly. Have fun. Eat some good, healthy foods. Last year I bought a griddle thing, Blackstone.
I saw that thing.
Griddle.
I saw
It's
that.
unbelievable. So if you want to make vegetables or you want to make your meats, or we did lamb on that, we did, vegetables on it. It just is a better way to cook than over a flame, because I think flame dehydrates proteins, and it's different compared to the griddle. So you were there when we had some spectacular lamb chops of the century.
Of the world ever, not century. We're talking BC, AD, I don't care.
Yeah, I love the griddle idea. And I tell people, and Dick's Sporting Goods has it. There are a lot of places that have them, but the Blackstone griddle I think is terrific, whether it's a small, medium size, large, etc. I think it's a better way to cook things. But yeah, people have to take the time off. And it's interesting, lately people, around holidays still want to come into the office. They love the idea. They love getting their vitamin IV set up. They love getting their B12 with their D shot, etc. Over the years, a lot of people would just be gone for the whole weekend. Be forced to take off because people want to come in, but we're busy. So again, I love the fact that people are, thirsty for information or knowledge, and they're working hard on getting their body healthy. Many years ago, I had to explain why people need to take vitamins. I've never in the past maybe 20 years, maybe more, have had to say, these are the reasons why you need to take your vitamins. Everybody knows that vitamins are great, and they're already taking things, they just want to get it fine-tuned. So I don't have to spend as much time discussing things because a lot of people are already interested in it. So it's great for me. No phone calls today, but 888-420-9272 if you'd like to call.
You guys.
That's all right.
Listen, I love you, chat, but you guys have a phobia.
This is not a phone generation. On the radio for 35 years, it was only phone calls, and it was just 30 phone calls per show. So, and it was great. I love the interaction, but I love the interaction, with the text as well. So why not? Just being able to reach people that are interested.
Oh, they're interested, Mr. Strawberry. I see you.
Let's see what else we have to look at here. Oh, the anti-aging realm. So when we talk about anti-aging, we're talking about real, live, absolute anti-aging mechanism. We're not talking about using cream from a plant that's supposed to anti-age your skin, which it's really not going to do. It's just going to make your skin look a little better hydrated or more moist. If we talk about correcting your vitamins, minerals, hormones, and for those people who want to go beyond that, injecting stem cells into the face or into the hair to help to have more cells in your face to repair damage, that's the real anti-aging mechanism. We talk about anti-aging from the inside and from the outside. So if we can have more cells in your pancreas, heart, lung, liver, kidney, brain, eyes, etc., from stem cell therapy, that's the only true anti-aging realm, because you're putting new cells, as you had years ago, back into those organs. If we talk about meeting your hormone requirements like you met on your own 10 or 15 years ago, Yeah, we're walking you back to where those were in great range so you have better function. Same thing with nutrients, with exercise. So we have to define what anti-aging really is as opposed to just trying to do something that, you're trying to put a little Band-Aid on something to try to change that. So I'm not adverse for people going to do some of the laser treatments where they do Fraxel or they, deep laser your skin, which makes you look horrible for the first week or so. And then, you get your skin improving over time. I'm not adverse for people going out and doing Botox and fillers and things, which is, that's, if people want that, that's fine. It's just that over time, you're not having new cells rejuvenate your tissues and your body. So that's why we talk about that whole realm, with stem cells as well.
I mean, that could be its own episode altogether.
Yeah, so we've done a lot of that. Probably a little bit more women compared to men with the facial, rejuvenation mechanism. So, in doing Botox, you're just putting a glove on the nerves to stop the contraction of the muscles, but your skin is still the same skin. And your muscles are still the same muscles, and the wear and tear is still there. When you inject stem cells in a similar fashion in every, eighth of an inch or 16th of an inch, and you're putting the stem cells into your skin and they layer out, you're getting billions over time of new cells that keep coming up and coming up and coming up. So that creates repair, it creates new. And they colonize there. It's just as if we're injecting something into a joint, stem cells colonize. They're not gone in a week or a month. So that's why for some of the facial rejuvenation, the results can be pretty dramatic.
Someone just said you look like you remind him of Papa John. Papa John.
Oh, the guy from the pizza the pizza thing?
Papa John.
Isn't it Papa John's Pizza?
Yeah.
Okay, he's a pretty good-looking guy. He's
Good
got
looking
good
guy.
hair. Yeah,
all right.
I take that. That's cool. I've had other people tell me I look like certain people, but I'm like, how do you see that? Someone told me I look like Alec Baldwin. I don't see that at all. And I don't yell and scream and rant, but I mean, he's a great actor, comedic actor. But I don't see that at all. I prefer to think of myself without looking like Tom Selleck without the mustache, which, of course, is not at all likely, but, I'd like to age like some of these people have aged well. I think Tom Selleck looks great, and he's certainly way older than I am.
Someone else said you're giving Eric Bowling. All right.
Eric Bowling.
He's a stud.
Yeah, he's cool. He's good. He's intelligent. I like that. I could deal with that. That works for me.
It's been a very eclectic conversation.
Yeah, why not? We could talk about anything.
I love it.
I tell patients we could talk about anything. Why not? That's what conversation's supposed to be. If you have a list of things you want to talk about and we go sideways a little bit, that's fine. It's just the way it should be. It's just good conversation. The worst thing is bad conversation or not being able to exchange ideas and thoughts. And look, there are people that have completely different opinions about things that I do. That's great. I love it. Talk back and forth and, express your ideas. Okay, great. That's great. Back and forth. If you talk to people that have the same ideas that you have, okay, that's good. It could be a good conversation. But sometimes a conversation, as you're, sparring a little bit back and forth, is even better. Not that I wouldn't try to change people's minds, but sometimes
it's only natural.
Well, yeah. So some people don't like to hear about the idea of changing their diet or, you want to get rid of all the carbs. No, I don't. I just want to be able to change enough for you to see benefit and then for you to say, wow, okay, now I understand and I agree with this or that. So I'm not rigid. I don't force anybody to do anything. When we talk about, I say, this is what I would recommend you doing. This is what I've seen happen in people that do this. And some people love that. There's some people who just don't want to do it. That's fine. Everyone's entitled to their opinion and to their ideas. I just like to get them to read more and expand and show them things, give them handouts. I think that good discussion and the discourse back and forth is great. Although if I discuss something with a patient, I know what's going to happen if they do follow the diet and the exercise. And I might tell them, I said, you're doing the diet, you're like halfway there. I said, you're already seeing some decrease in your triglycerides, so that's great. You got to give them a little bit of coaching. I said, you're doing the exercise 3 days a week, let's go to 4 days. And you see more result. And all of a sudden they see more result, let's go every day, go for the walk. And all of a sudden, everything starts to fall into place. And they're like, you're right. I've only done this for, 37 years. So, and I don't take offense to anything. If people don't want to hear, that's fine. And sometimes that challenge to get that person to do the thing, which I know will work, and then they'll turn around and say, oh my God. And then the funny thing is the people who don't really want to do it or don't really believe or blah, 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 because they've taken some vitamins before on their own, they didn't get a result. As soon as we fine tune it and create it, all of a sudden they become the biggest proponent. And all of a sudden, their aunt, their uncle, their cousin, their brother, the whole family comes in because they've seen that outcome or that result. I like the challenge.
We know that, Doc.
Yeah.
Oh, we got a dog photo to show.
Oh yeah, got a couple of dog photos. Look at those little babies. So for people who don't know, Zeus is the German Shepherd. He's about 125 pounds. He's about 7 years old. Delilah is the baby. She's only 14 months old at this point. And they're both so connected with me, and I love it, except sometimes I want to have space to myself. They're always within inches of me. If I sit at the table, they're always right next to me, so I have to be careful and look up whenever I get up. This picture is both of them just lying on the deck. I was sitting out on the deck relaxing, and they just sit there waiting for me to get up or move, and they're just ready to do something. A lot of times they'll sleep. The other picture with Delilah, where I have the deck off of my kitchen has seating in it, built into the deck, and I'll in the morning go out and kind of put my hands on the top railing, and you've seen it. Delilah will always follow me, come over, put her front paws on the seat, and stick her head up in between my arms because she wants to look out at the yard. So every morning she'll do this without fail. So it's great to just scratch her and give her hugs and kisses. And she, I guess just like people, animals become creatures of routine. So when we get her outside, she may just put her paws up on my shoulders because she's that long and that big now. And she'll put her nose in my face, and then she'll just like peck me, like give me a kiss in the face. And then similarly, she'll just sit there and we'll just look out together. And I think it's the funniest thing because we're just surveying, the backyard. You have the other picture when she's super long?
I only had those two.
Oh, okay.
We'll get them next time.
Yeah, there was one more when she's just standing, sort of stretching on her paws on the seat of the deck, and she looks like she's 8 feet long, which she's probably not far from that. But it's terrific, and I think more people should have pets. Some people are cat people, dog people, squirrel people, all sorts of other animal people. That's great. I think everybody should have pets. But they're the best.
Just don't have my dog over because that squirrel's gone.
Oh, yeah. Well, it's funny because years ago when I first got my house, I used to put pots on the deck and have little cherry tomatoes and this and that and arugula. And invariably, I'd get up in the mornings before I had any of the dogs. The squirrels would get there before me and eat some of the tomato, leave it on the railing, and then run away. It made me angry. So I tried everything I could to try to get the squirrels to stay away. Didn't work. When I got Maximus, who was bigger than Zeus, I used to comb his hair. And I had the idea of combing the hair and just dropping it off the side of the deck in the bushes. From that point on, that was 2016 or so, not one squirrel, no raccoon, no possum, nothing has come near the deck because I think they smell or understand that there's a big dog there. So every time I got to brush them, and they need to be brushed, they're long hair, and this is the season when they start to shed, I got to brush them. It takes me forever. I'll just put it around and there's nothing will come by, not even close. So I've had friends that say, hey, can you just brush your dog and give me a bag of dog hair? I'm like, what? Because the same thing for their gardens. Nothing goes near my garden because the dog hair I put around the...
Genius.
Yeah.
We might have a product on our hands.
I'm telling you, it works. Okay, so we're down at the end of the program. This is, 93 minutes.
Ripping
good.
today.
A lot of great questions. Thank you for tuning in. We'll be here tomorrow at 2:30 live. Looking forward to our full-blown, awesome, most spectacular LFA friends. And everybody else, TikTok, Facebook, Instagram. And love all your questions. Your engagement is great. Comments are great. And we look forward to talking again tomorrow. God bless.